In this video clip, I'll be discussing muscles that are located within the arm. These muscles are found in between the glenohumeral joint and the elbow joint. And typically they're involved in either producing flexion of the elbow joint, which we can see here, or extension of the elbow joint, which is demonstrated here. Next, I'll discuss these muscles in more detail. In the anterior compartment of the arm, there are 3 muscles. Before I discuss their attachments, I'll highlight them here. Here we have biceps brachii, which has 2 heads. And if I just hide biceps brachii underneath, we see brachialis. And then lastly, we also have coracobrachialis. Biceps brachii has 2 heads. Here we can see the short head here, which is attaching to the coracoid process. And the long head, we can see the tendon of it here, which runs actually right through the glenohumeral joint and attaches to the supraglenoid tubercle of the scapula. These 2 heads come together and form a nice big belly within the arm and go down and attach onto the radius. I'm just going to remove this muscle here so we can see its exact attachment. Now that brachioradialis has been removed, we can see that this particular muscle is attaching onto the radial tuberosity of the radius, and also parts of the muscle attach into the fascia of the forearm by attaching into the bicipital aponeurosis, which you can see outlined here. Demonstrated here in this animation is flexion of the glenohumeral joint. Here's flexion here. And biceps brachii helps to produce flexion at the glenohumeral joint. Distally, biceps brachii helps to produce flexion of the elbow joint. And in addition, because it attaches onto the radius, it can also help to produce supination. In this animation here, we can see the forearm going through pronation and supination. Here we have pronation, and then here we have supination. Because the distal attachment of biceps brachii attaches onto the radius, it is affected by forearm position because the radius moves as the forearm pronates and as it supinates. Deep to biceps brachii, we can see coracobrachialis and also brachialis. Coracobrachialis starts proximally on the coracoid process and distally goes down and attaches to the medial surface of the humerus right here. When we pull along this muscle up towards where it starts this way, it can help to produce flexion at the glenohumeral joint and also can help to produce adduction at the glenohumeral joint. The last muscle here that we'll discuss in the anterior arm is brachialis. Here's the proximal attachment of brachialis, which is considered to be the distal half of the humerus, and it goes down and attaches onto the coracoid process of the ulna, which is partly covered up here by the capsule of the elbow joint. When we pull on this muscle up towards where it starts, it will help to produce flexion of our forearm, or flexion of the elbow joint. And because it attaches onto the ulna, it is not affected by forearm position. Here in this animation, we can see brachialis just deep to biceps brachii. And we can also nicely see its attachment site onto the coronoid process of the ulna. And as I previously mentioned, because it attaches to the ulna, it's not affected by forearm position. All 3 anterior arm muscles are supplied by the musculocutaneous nerve, which we can see here in yellow. This particular nerve is a terminal branch of the brachial plexus. It pierces coracobrachialis and eventually becomes a cutaneous nerve in the forearm. On the posterior aspect of the arm, there are just 2 muscles. We have the large triceps brachii muscle and this smaller, tiny little muscle called anconeus. Both of these muscles are supplied by the radial nerve, which is also a terminal branch of the brachial plexus. We can see it here. It runs deep to these muscles on the posterior surface of the humerus, and then eventually will enter into the anterior aspect of the forearm. Triceps brachii has 3 heads. It has a long head, a lateral head, and lastly, a medial head here. The long head of triceps brachii attaches to the infraglenoid tubercle of the scapula, whereas the lateral head attaches onto the posterior surface of the humerus, just above the radial groove, and the medial head attaches also to the posterior surface of the humerus, but below the radial groove. We can't see exactly where it attaches here because the medial head, its attachment site, is covered up by the lateral head. Eventually, fibers from all 3 of these heads, they merge together and attach onto the olecranon process of the ulna. Just distal to triceps brachii, we find anconeus. And anconeus is sometimes actually fused directly with triceps brachii. It acts as a synergist at the elbow joint, and it also helps to tense the capsule of the elbow joint during extension to prevent the capsule from becoming pinched. In this animation here, we can see that both triceps brachii and anconeus work together to produce extension of the forearm during the concentric phase, which is right here. And during flexion of the forearm, these muscles are eccentrically contracting. One last note to make is that because the long head of triceps brachii crosses behind the glenohumeral joint, it can produce or help to produce extension at this particular joint.